12, and they look just like a pearl necklace. It's so beautiful. And if they, and we call those PA or the B reaction. If you get four or less bionds, then that's a T reaction. But if it's 5 or more, it's a B reaction, and it stays that way as long as you keep putting in saline solution. If the energy level is low in the body, you don't get those bionds you see down below T-spike cell. You don't get those bodies. You don't get those PO bionds, and you get on the outer on the periphery. You get it starts spiking. You can't miss it. But the thing is, of course, if you're with cancer patients, you get this almost with everyone. So it was always a good test for anybody who had cancer or tended towards cancer. Now, then if we tested for people that took different medication, and in 1950 they were still giving sulfa drugs, and even classical medicine knew that sulfa drugs was not had deleterious side effects on the blood, but with the way we observed it, it formed the sulfur form. It's just a solid mass there. Now, how did we counteract it? The T-spike, the T reaction. We used to put those patients, still can do it actually, in an accumulator, and then take a blood test about once a month over a period of 3 or 4 months, and almost invariably the T-spike phenomena would not occur. You get the PA or B reaction. And we had a lot of cancer mice that we got from the little laboratory, famous laboratory up in Maine, which used to grow cancer mice strains, maybe 500 generations, they were pure cancer mice. And we would inject, we would put the cancer mice in smaller accumulators. And you see the healthy blood mouse and the cancerous blood mouse. You see that there. And also the white blood corpuscles, they were always slightly larger. The lymphocytes slightly smaller than the red blood cells, are brightly luminous, and are very resistant to disintegration. They are easily distinguished after settling has been completed by focusing upward with the fine adjuster of the microscope. And that would show if the energy level was low, a leukocytosis or problem leaning towards leukemia, which about 70% of the time would reverse itself after being in the accumulator. That was another thing. It took a lot of experience and looking at a lot of blood before to be able to really tell, because it was up to the observer. And the more you're in contact with your own body, the better you could distinguish a healthy B reaction from T reaction. And I'll read this. The estimation of the criteria for healthy or sick blood requires much experience. Many samples of blood from different sources must first be examined and compared with each other. It means long and patient hours at the microscope. For the acquiring of this skill, it is important that the same microscope and the same magnification, the same centering of the light, and the same intensity of the light source be used by the observer. One should not lose sight of the fact that the examination of the blood cells and tissues outside the living organism brings about a rapid modification of these cells. In order to gain the closest examination to the true physiological appearance of the cells, the blood must be examined immediately. Now, see, I'm getting very technical, and I don't know how not to do it. You know, I'm used to giving it to doctors, but I'll continue. The appearance of biomes within the frame of the red blood cells is due to the fact that the even distribution of the orgone energy has been modified. There is a gradual loss of orgone energy so that there's not enough to maintain the tautness characteristic of the healthy cell. Now that's an important statement to me and the Orgonomist. Now, Dr. Reich felt that the cause of cancer was the lower of orgone energy in the body cells. And that classically it was always felt, they always said that cells proliferate into more cells than the organism could accommodate, or the organ, liver, lung, or anything else. And as a result, the normal chemistry and physiology was deleterious to the body. We see in breakdown of the red cell, you get the T-spike cells. And if you allow a normal cell to break down and the energy, it does dissipate, and you keep it alive, it breaks down into an amoeba. And that's what Dr. Reich said. A logical deduction can be made as to the original energy content of the cell. And you see that the weaker cell goes into shrinks, you get the spiking, and you know the energy content of the cell was not very high. The two different variations of disintegration, the healthy and the sick, are referred to as beta reaction or PA reaction, healthy, and T shrinking or sick reaction, respectively. In diseases such as cancer, where the biological debility of the cell is extreme, the disintegration is almost 100% in a T reaction. That's a T reaction. The cell which disintegrates in the PA or B manner has a greater amount of orgone energy from which the biomes are formed. And as a consequence, these biomes are larger, a deeper blue, and more sharply delineated. In the cells which disintegrate in the T manner, due to their lower energy content, only small biomes or T-spikes will be formed. The T type of disintegration, while almost always found in cancer, may be found in other biopathic conditions. Diseases arising from a disturbance in bioenergetic pulsation. We never we never went into other diseases. I mean, we never had that many cases available. We tried to get permission at the hospitals. We said we would take every other case just to do this, you know, and they just said, it's a lot of nonsense. So that work all has to be done, little by little. I don't know who's really doing the blood tests. I think some of the doctors and
almost nobody.
No, almost nobody. It takes
no,
a lot.
No one is doing it consistently.
Takes a lot of time and money, and it's a shame.
But you did just quickly. You did do work with with some other, you did work with TB patients, did you?
Oh, well, yeah, I did, yeah. Well, that was early. I did treat 3 tuberculous patients. On the couch and with the accumulator. I wasn't going to bring that in, but I'll discuss it. There was one woman, she was a wave in the Navy, and she developed tuberculosis. And it was pretty fulminating. And at that time, they did treat it with they had a couple of streptomycin and another drug, and she wasn't getting anywhere. And they were recommending that they do a lobectomy on one of her lungs. And her husband had been in treatment with me, and he asked me what the accumulator could do. Well, I was young and daring, and I said, well, bring her around, we'll see. So I had her on the couch, and then I also had her sit in the accumulator 2 or 3 times a day. In the meantime, I said, I better get some protection here. I don't know anything about it. So I knew a doctor who was in charge of a TB hospital over near Bell Harbor. It was called Seaview Tubercular Hospital. And I spoke to him, and I asked him, would he follow the case, and if he thought at any time that she was getting worse, that he would have to recommend that she go on with the operation. I said, okay. Well, after a couple of weeks, she started to feel much better, and I sent her to him, and examined her. He said, well, she still has it. He took x-rays, and he said, but it is better. And we continued for a couple of months. And after about 3 months, he says, you know, it's sort of a remission. I don't know what you did. He said, but I'm not going to do it. and then she went on. She married. She had this girl. She has this girl. And I see the mother's down in Florida. And this is what, 52? That's what, 40 years ago. Still no recurrence. The daughter, fine. Never had anything. And the husband's fine. And I had several others, but not as serious as she was. And they responded quite well. They never needed any medication anymore. And then Dr. Ike wanted me to give a report. And I went up there one-to-one, and I gave him the whole history and what I did and all like that. He looked at me and he said, boy, he said, I would never have done that. So I said, well, what do you think? He says, you're the specialist, not me. He said, I never did that. So that was in the young days. But then, of course, the government came in soon after that. And then practically all the ergonomists stopped using the accumulator in their office and stopped prescribing it to their patients. The only one who still did it was Dr. Silver with Mangarini. Anyhow, but I still, if you remember, I still kept my accumulator in my office in 50 East 10th Street. And I did prescribe the patients. But after Dr. Reich developed the accumulator blanket, which he felt was better, and I like it better than the big accumulator too. You can relax with it and all like that. Anyhow, but the other doctors, after Dr. Reich died, Dr. Baker decided to leave the group, and he had